Assalamu alaikum warahmatullahi wabarakatuh. To carry on with the embryology lectures, I'm gonna cover in this presentation the development of the duct system in male. I'm Dr. Dalia Saleh, professor and the head of anatomy department at Mansoura University. The objectives of my presentation will be, first we will cover the indifferent stage regarding the development of the mesonephric ducts and the paramesonephric ducts. Then we will discuss the different stage in development of the male duct system, and we will try to answer the following questions. Which duct predominates in male? Which duct predominates in female? And the derivatives of each duct in male. And then I will talk about the external genitalia and male urethra development. For the indifferent stage in development of the male duct system, the first appearance of the duct system by the appearance of a pair of mesonephric ducts or Wolffian ducts. They appear in the intermediate mesoderm, like we discussed before in the development of the urinary system, and into which the mesonephric tubules or the collecting duct system of the mesonephric tubules empty into them. And then a pair of paramesonephric ducts or Mullerian ducts appear lateral to the mesonephric ducts. They develop from a longitudinal invagination of the coelomic epithelium, and they lie anterolateral to the urogenital ridge. What about the paramesonephric ducts? Cranially, it opens in the coelomic cavity by a funnel-shaped end, and then passes lateral to the mesonephric duct like this, then crosses it ventrally to get into its medial sides. Eventually, they open in the posterior wall of the urogenital sinus in a projection or in a tubercle called Mullerian tubercle. The mesonephric ducts, if we talk a little bit about it, they are the collecting duct of the mesonephric tubules. They lie dorsolateral to the mesonephric tubules and open on each side of the Mullerian tubercle. If we take a cross section in an embryo, you can see the intestine here. This is the dorsal mesentery, where the intestine is attached to the posterior abdominal wall through it. This is the intermediate mesoderm where the kidneys or the urinary system will develop. So these are the mesonephric tubules, and they open into the mesonephric ducts. Anterolateral to this mesonephric ducts or the urogenital ridge lies the paramesonephric ducts. And this is, of course, the developing gonad area. Next, we will talk about the differentiation of the male ducts. This is a section in the adult male testicles. It should look like this. This is the seminephros tubules. Their ends collect into a network called the reed tests. They are connected by basa efferentia to the epididymis. The epididymis is formed of a head, body, tail, and this is the ductus deferens or the vas deferens. What about the effect of hormones secreted by the male in the development of the duct system? First, you know that the testis secretes two types of hormones. The first one is called Mullerian inhibiting substance, secreted by the Sertoli cells. This hormone prevents the Mullerian ducts from developing. So from its name, you can figure it out from its name, Mullerian inhibiting substance. Thus, it inhibits the Mullerian ducts or the paramesonephric ducts from developing. Thus, this hormone has a defeminizing effect, like it wipes out the feminine features from the male. The other hormone secreted from the testes is the testosterone secreted from the Leydig cells, and this hormone stimulates the Wolffian ducts or the mesonephric duct to develop. Thus, it has a masculinizing effect in the embryo. Now, let's see the derivatives of the mesonephric system in male. If you look at this diagram, you can see the developing gonads or the developing testes here. This is the mesonephric tubules, and this is the mesonephric duct, and anterolateral to it lies the paramesonephric duct like we mentioned before. So what happens to the mesonephric tubules? The superior ones, superior to the developing gonads, will form what's called superior apparent tubules. The middle ones lie opposite to the developing testes. They will persist and form the vasa efferentia. The inferior mesonephric tubules lie inferior to the gonad. They will form what's called inferior apparent tubules. And the caudal ones, caudal to the inferior mesonephric tubules, will form a rudimentary structure called the paradidymis. So from this diagram, you can see that the only ones that persist and are functioning are the middle mesonephric tubules, where they lie opposite to the developing testes, and they will form the vasa efferentia. Also, the other part of the mesonephric tubules that will persist and form a structure you can see in the adult are the caudal ones, where they find the paradidymis. The superior apparent tubules and the inferior apparent tubules will eventually degenerate. Then, what happens to the mesonephric ducts? The most superior part of the mesonephric duct will persist as an extension above the epididymis called appendix epididymis. The middle part of the mesonephric duct will form the head of the epididymis. Thus, it will be connected to the vasa efferentia. The inferior part will form the body and tail of the epididymis, and the caudal end of the mesonephric duct will persist and form the vas deferens. If we move more and more towards the caudal end of the mesonephric duct, we will notice an outbudding or outgrowth of the mesonephric duct near its termination. This outbudding will form the seminal vesicle. Caudal to it, the ejaculatory duct will form. So far we have 6 derivatives of the mesonephric duct in male. The very cranial part will form the appendix epididymis, and then it will form the head, the body, the tail of the epididymis, then the vas deferens, then the seminal vesicle, then the ejaculatory duct. And do not forget that the mesonephric duct also gives rise to the ureteric bud and the urinary bladder trigone, and also we will learn now it will give part of the posterior wall of the prostatic urethra. What about the paramesonephric ducts in male? Remember that the Mullerian inhibiting substance secreted by the Sertoli cells of the testis will inhibit the development of this duct system in male. So eventually the paramesonephric duct in male degenerates by the effect of the Mullerian inhibiting substance, except the very cranial end of it will form an extension above the testis called appendix testis, and also the caudal end of the paramesonephric duct will form a very small part can be found inside the prostatic urethra. It's called prostatic utricle. For the development of the external genitalia, we need to know how the sex is determined in the embryo. We have sex determination in 3 stages. The first stage is the genetic sex, and this is of course determined at the time of fertilization according to the X or Y chromosome carried by the sperm that will fertilize the ova. Then, according to the presence or absence of the Y chromosome, the gonadal sex is determined. So, if there is a Y chromosome, the embryo is XY or a male, then the Y chromosome will inhibit the formation of the ovary and stimulate the formation of the testes. And vice versa, if the embryo is XX, means that she will be a female, then there is no Y chromosome, then the default pathway for the development of the gonad will be towards the female side. Then, according to the gonad format, either testis or ovary, this will affect both the phenotypic sex, both in the internal genital organs and also in the external genital organs. So, for the external genital organs, in the indifferent stage, the cloacal membrane is surrounded by two folds of mesoderm called cloacal folds, which meet anteriorly to form a tubercle called the genital tubercle. On each side of the cloacal folds, two swellings appear. They are called the genital swellings. This appearance can be seen both in male and in female in the indifferent stage, where you cannot discriminate between male and female at this stage. Also, remember from the division of the cloaca that the urorectal septum divides the cloacal membrane and will also divide the cloacal folds into two parts: urethral fold above and anal fold below. Again, the cloacal membrane is also divided by the effect of the urorectal septum into two membranes: urogenital membrane above and anal membrane below. In the different stage in male development of the external genitalia, this occurs around week 10 or 11, and it is under the influence or effect of testosterone from the testes. The genital tubercle in males will elongate and move away from the anal opening and begins to form the shaft and head of the penis. Over the next few weeks, the urethral folds will approximate to each other and fuse, and they will form the penile urethra, which lies inside the penile shaft. In this cross section, you can see how the two urethral folds approximate with each other and fuse, and thus enclosing the penile urethra in between them. However, the distal end of the penile urethra is ectodermal in origin, and it appears like a solid cord of cells arises from the tip of the glans penis. Then later on, this solid cord of cells will become canalized and continue with the rest of the penile urethra. So now the opening of the urethra will open at the tip of the glans penis. This is the genital tubercle that will grow and form the penis, and these are the urethral folds that will fuse together and form the penile urethra, and lateral to them lies the genital swelling or labioscrotal swelling. The labioscrotal swellings or the genital swellings will fuse together and they will form the scrotum. Also, tissue extends from these swellings will fuse around the urethral folds, completing the formation of the shaft of the penis. Like this. You can see the urethra, penile urethra, and these are the two urethral folds, and the labioscrotal swelling or the genital swelling will grow and wrap around the urethral folds to complete the formation of the penis. So if we compare the development of the external genital organs in both male and female, we'll find that the genital tubercle in male here will grow and form the penis, while in the female it will remain small and form the clitoris, like this. The other difference is in the urethral folds. They will fuse in the male and form the penile urethra, while in the female they will remain open or separated and form the labia minor. But inside the two labia minora, you can see the opening of the urethra and the opening of the vagina. The genital swellings or the labioscrotal swellings in the male will fuse together and form the scrotum, and also will surround the developing penis to complete its formation, while in female they remain separated and form the labia majora. This is the end of my presentation. Thanks for listening, and I hope you like it.